Hi, everyone, and welcome to today's webinar. I am attempting to not get my webcam shown. I'd like to show you my screen instead. Okay, great. So welcome to the Defeat Malnutrition Today webinar, Working Together, Tips and Strategies for Building a Malnutrition Advocacy Coalition. We are really excited to have some great speakers today to talk about both the general formation of coalitions and then to provide some great examples of what they've done in their states and nationally. So this is, again, being hosted by Defeat Malnutrition Today. If you are unfamiliar with the coalition, we are a group of 99 national, state, and local stakeholders and organizations. And we are working to create policy change to achieve the recognition of malnutrition as a key indicator of older adult health risk and toward a greater emphasis on the screening for malnutrition and treating and preventing it. So I would note that 99 number. If your organization is interested in becoming 100, that would be really great. So with that, I'm going to turn things over to Jeannie Blankenship. She is a registered dietitian nutritionist and the Vice President of Policy Initiatives and Advocacy for the Academy of Nutrition and Dietetics. Jeannie is the visionary for the Academy's advocacy platform, which focuses on professional issues for dietitians and nutrition professionals, as well as food and nutrition issues for consumers and the community. Her advocacy work includes issues such as coverage and reimbursement for medical nutrition therapy, malnutrition, hunger and food security, telehealth, and workforce demands. So with that, I'm going to turn it to Jeannie.
Thank you, Meredith. Can you hear me okay?
Yes.
Okay, thank you. So most of us know that coalitions are groups of individuals or organizations that come together with a common interest and who agree to work together towards a common goal. So today we're going to be talking about how you might apply these principles when it comes to malnutrition. But of course, much of the information that you'll hear today can be used with any type of activity. There are so many different types of coalitions that exist. They address a multitude of issues. Here in Washington, D.C., where I'm located, we really rely on these coalitions to advance efforts and to make sure that when we're moving forward with a particular issue that we have buy-in and agreement from the stakeholders. So I'm going to spend a few minutes today briefly walking through the coalition building process, and then you will hear from Lisa, who's going to share her experience and the real world application of some of the principles that I'm talking about today. Let's go to the first slide, Meredith. So why start a coalition? And I like this picture because I think it really symbolizes coming together, and that it really is coming together with a unified purpose and a goal and a vision. That doesn't mean that organizations or entities might not have their own separate goals or agendas outside of the coalition, but it really allows you to come together with that common theme and purpose. So there's a number of reasons why coming together in terms of malnutrition might be a good idea, but it will allow you, if you bring the right people together, to concentrate your state or your community's focus on malnutrition and to create those alliances among different groups that typically might not work together or might have limited crossover in a normal activity or daytime operations. But this will keep the community or the state's approach also consistent. So how are we going to address malnutrition in a specific state? We've seen some great examples, and certainly there are archived webinars on the Defeat Malnutrition Today website that you can access, where we gave examples of states where they have approached malnutrition from a coalition or bringing together a group of people to either convene a state task force or to have malnutrition inserted into an existing group, or perhaps even to introduce legislation. So again, there can be a lot of different reasons or goals that come from that coalition building, but coming together with that common purpose is really important. Coalitions can be loose associations. So as you start to think about this, you can go back. I'm not quite to that one yet, Meredith.
I'm
Coalitions
sorry.
can be, no, that's okay, can be really informal. And I think that's the main point of an initial discussion when we get to that, is that start with the idea and the passion, and then we're going to talk about how you build onto that. And you don't have to be thinking in the end, well, oh my gosh, do we need to convene this and file paperwork for tax exempt status? Don't get ahead of yourself. I think the first thing is to think about bringing together that group of people to achieve a common purpose. So some of the reasons why forming a malnutrition might be helpful in your particular state or community. One of the first things is that it really brings about more effective and efficient delivery of programs, and it can eliminate any unnecessarily duplication of efforts. So for example, if my organization is already working on access to malnutrition after hospital discharge, then there might be another group that's doing that same work, but we're not working together. And so we're duplicating efforts and we're not going in with a unified approach. So again, it can help in that aspect. One of the biggest reasons why coalitions are formed is to pool resources, and that includes both human resources and financial resources. So how do we use the limited amount of funds that we all have available and effectively work together so that we can accomplish a task that we perhaps couldn't do on our own? So if we work with people and organizations in a coalition, we can do that. We can accomplish together what one organization cannot do alone. The third thing is that we can increase communication among groups, and we can also break down some of the stereotypes that exist. And even though I don't like to admit it, I think they do happen in the nutrition community. That includes things such as, oh, well, that's the food security people, or, oh, those are the healthcare or the medical people. Oh, that's the senior community. So really taking those walls down and trying to communicate across the groups can help us to break down those barriers and preconceptions and help to develop trust between the various organizations. The next reason is that, and I think many of you can identify with this, is that coming together in a coalition for a common purpose, and many of us on the call today are really passionate about working with seniors or working in the space of malnutrition, but some of us have sagging energy levels because we're trying to do a lot and we're trying to do it alone. So coming together with a group of people can really bolster the efforts around the issue, and it can give the people that you're working with, or even you as a professional, that sense of belonging and accomplishment, because you are going to achieve more as a coalition than you're able to do individually. Next, you're able to plan and launch initiatives on a variety of issues. You see that, I think the Defeat Malnutrition Today is a great example. If you go to the website, you can see that across all different areas, regulatory comments, webinars, other types of education, advocacy efforts, they're all listed there. And so you're able to consider the bigger picture. You start off small, but as you come together and as you see the richness and contributions of those that are partnering with you, you're really able to take a group and a topic such as malnutrition in a whole new direction. The next is that you can develop and use, and this is really important, the clout to gain services or other benefits for the community. So that group coming together and advocating on a particular topic, so malnutrition at a national level, has increased visibility because we are working as a coalition. Again, we all have our individual approaches to this and our own goals within the organization, but as a coalition, we're really able to bring that clout and then to use that when we're trying to advocate here in Washington on the Hill. And if you were doing this back in your state, you'd obviously be looking at state or local initiatives. And then finally, one of the reasons why you can come together, and this is going to depend on the goal that you're trying to achieve, is that you might actually bring a coalition together to obtain or even to provide services. So you could look either initially or over the long term to design, obtain funding, and then run some sort of intervention in the community. Maybe you realize that there's a gap in a community-based program, and that if you had resources, you would be able to specifically target and treat malnutrition in a specific population. So those are some of the reasons why we might come together. And I had a reference listed on the next slide of a really great resource, and I'll talk more about that, but there are many different reasons why to start coalitions. We can go to the next slide, Meredith. So getting started, the first step is to have a brainstorming session that includes a few individuals that are passionate about malnutrition. Ideally, you keep that convening fairly small with perhaps 10 or fewer attendees. And as part of this discussion, think about what the purpose of a coalition might be in your state or in your community. Keep in mind that you potentially, through this dialogue, could discover that the topic of malnutrition could be addressed within an existing coalition. And I would share an example that in my early career, a colleague and I joined forces to launch a breastfeeding coalition. And we didn't have the resources to fund the group, but we were able to work with a group that was called the Healthier Communities Coalition, and we launched a subgroup within their coalition. And over time, we were able to split off and to exist as a separate entity, but we were able to use their umbrella, their connections, their networking to launch our topic. So really be open to alternative ways of looking at your options. The next thing is to think about coalition goals, and those are really as varied as the coalition themselves, because when you get that initial group together, you're going to start thinking about what's appropriate for you in your community. But typically the goals are going to focus around influencing or developing public policy. It could be that you're working towards changing a particular situation in your community or behavior. So perhaps you have a community where seniors are resistant to receiving additional support through some of the food security programs, and you might be addressing, well, how do we actually get them to utilize food banks or to participate in some of the feeding assistance programs? And then oftentimes these coalitions really come down to focusing or building a healthier community and working together to achieve that. As you get started and you bring that group together, you want to develop a short list of like-minded organizations. So this is your initial first stab to come up with a list of potential organizations or groups that share an interest in addressing malnutrition. The resource that I mentioned earlier and is at the bottom of this page. It's fantastic. It has great tips for getting started. There's a section on developing a coalition, and then more importantly, there is also some sage advice on how to maintain or manage your coalition, which I'll touch on before we close today. But really, that's a great resource for you. As you think about the potential members, if you go to the next slide, Meredith, I came up with kind of an initial list, and certainly by all means, this is not exhaustive, but in thinking about who you might include in your invitation list, this might help just spur those discussions and to think about it. So I mentioned nutrition organizations. I think they're an obvious partner when you start to talk about addressing malnutrition. And this includes groups that are working on food security. It could be food access, groups such as food banks, your local dietetic associations, groups such as the ASPEN local groups, American Society for Parental and Enteral Nutrition. There's many organizations, and I hope I didn't leave any off that should be included there. But nutrition proper organizations are obviously natural partners for this. The other thing is to look at industry partners. So thinking about your food system in your community or your state. Are there specific suppliers? Are there healthcare industry partners that you might think about? We have several that have been involved with the Defeat Malnutrition Today Coalition that have a focus on nutrition and are coming at it from an angle of being a supplier and providing support services. Programs that serve seniors certainly are congregate meal and home delivered meal programs, as well as other senior services are a natural fit for this area as well, because it comes out to the all eyes and ears and who's having those touch points that might be able to help with addressing malnutrition. Nonprofit groups, religious organizations, I included that there for a variety of reasons. They often have health and wellness committees. They're also often very active within the advocacy of a particular state or local area. And many of them offer food banks or some sort of food pantry access for their congregations. And then, of course, health and medical organizations and businesses, as well as state government agency and programs. If you can get policymakers, either local or at the state level, former elected officials that are no longer serving in office. Folks like that are particularly helpful to these types of coalitions because they can help drive your efforts forward. So let's look on the next slide. Talk about the first meeting. I included this picture here. This was a drawing from a convening that was held, and we worked with one of our partner organizations, but I think it was really just a great summary. I love that we're doing these in meetings these days, and I'm so inspired by folks that have the talent and skill to be able to document meetings like this in an artistic form. It's just really great. But what I want to focus on that first meeting is it's not a come together and you have all the answers or all the ideas, or that you even have a concrete sense of where the coalition is going. That first step is really to bring people together and to network and to share the mission and the vision of the various groups that are involved and to look for those points of commonality. The next thing you want to do is to think about your coalition and what the expectations might be for those who are participating. Is this going to be something where they need to take a leadership role? Are they going to need to be in attendance? Can they provide resources or participate via teleconference? Figuring out some of those logistical issues during that first meeting can help everyone know what their role might be. And that goes into the operations and structure as well. Are you having monthly calls, bi-monthly? You might not have all those answers up front, and you might also convene and then decide that you want to take a step back after that first convening and regroup with your initial core group and redefine the forward movement. You want to think about those proposed goals. So when you brought that smaller group together, you had an idea, okay, we're getting together because we want to pass a state law that addresses malnutrition coverage. So if that was your initial goal, you want to bring that then into the coalition. And does everyone agree that that's the purpose of coming together? Is that something everyone wants to support? And usually you're going to have a few different goals so that you have natural development of groups within your coalition that will work on specific issues or topics. Another aspect of that first meeting is to think about who's not there, who should be at the table that isn't participating. And this is where you want to stretch your imagination and think about who is having access or who's kind of an uncommon person that might be able to share the messages related to malnutrition, but that isn't in the room. So maybe you didn't include pharmacists, but you realize in your community that they're an important link to bridging the healthcare system, or perhaps there's a specific transportation system within the community that's charged with helping folks get to and from appointments. And do they potentially have a role here? I mean, it really can cross the entire gamut, but that opportunity of letting those individuals who are in the room, that larger group, to help contribute to your short list can be really helpful in developing your long-term success, because you'll have a richness within the organization and a variety of viewpoints. And policymakers like that. They like to see that bridging and conversation between different groups to reach common goals. On the next slide, what do you do once you've got it going and you're thinking about, okay, we brought this group together, how do we keep it going? Well, again, check out the resources on effective management. Those will really help you to think about having that maintenance plan and what needs to happen to grow your coalition. Again, you're going to, at the beginning, perhaps say, well, we don't want a lot of structure, but you might decide over time that you do want more structure and that you want to pursue that. And you might decide over time that it's worth pursuing funding, or that you want to have elected leaders. All of those things can happen if you take the early steps and listen to those that you convene. And then measuring and reporting the progress on your goals. I think that's one of the real keys to keeping people engaged in a coalition, is they have to feel like that their partnership or the work that they're doing is relevant and that it's going to make a difference. Ask them on a regular basis for feedback about the activity of the coalition and what they would like to see. Perhaps they have ideas for different speakers, or perhaps they have connections or ways to approach a conversation with a policymaker. Maybe they know someone that you could meet with to advance your cause. So really getting that feedback on a regular basis is extremely important. And don't be afraid if you see a waxing and waning of organizations within your coalition. It's not uncommon, especially as your leadership rotates. But it's not uncommon to have an organization really take a strong role in one phase and then back off for a bit and remain engaged, but perhaps isn't giving the same level of input or resource, but over time, given the right scenario, could step back up. So don't be surprised if, depending on the issue that you're working on, you have more engagement by some organizations, less by others. That isn't really the important thing. The most important thing is to keep them there at the table, to keep them engaged, and that they feel comfortable with their role and the contributions that they're making. And then on the next slide, I just give you my contact information. And I mentioned that I have some experience bringing together a few different coalitions. And I'm very proud of this picture here of Bob and Representative Bonamici and I. This is at a briefing that we held prior to a hearing on the Hill last spring. And just a great way for us to come together as Defeat Malnutrition today and support one of our policymakers that's active in senior issues and especially supportive of nutrition services programs through the Older Americans Act. I am going to pass it back to Meredith. Thank you.
Great. Thank you so much. That was so valuable. Next up, we're going to have, oh, and by the way, folks, if you have questions, we're going to take those at the end, and you can type those into the question box for future reference. So next, we're going to have Lisa Nierenberg, who is going to talk about her personal experience with coalition building. This is not a nutrition coalition, but the work that they have done is very valuable and I think provides a lot of great lessons that we can keep in mind going forward. So Lisa's been a leader in the field of elder abuse prevention for over 35 years. She is the executive director of the California Elder Justice Coalition, which was formed in 2012 to provide a voice from the field to state policymakers. And she's an instructor at City College of San Francisco, where she teaches classes in gerontology, elder abuse, and ageism. So with that, Lisa, please take it away.
Great. Thank you so much, Meredith. And also, thank you for that great presentation before mine. It really got me thinking about the coalitions that I've been involved with. So when Meredith asked me to do this presentation, I was a little bit reluctant at first, and I made a point of telling her I don't know much about nutrition. And she said, well, that was okay because you all do. And what she wanted me to talk about was really my experiences with coalitions. So that's something I'm comfortable with. And in fact, sometimes I think of myself as the poster child for coalitions, since I've been involved in coalitions for most of my professional life. And I've been working in the field of aging and elder abuse for over 35 years. And at any one point in time, I've been involved in at least one coalition. So I'm calling this Reflections on Coalitions. I'm not coming to you with hard data or even particularly tips. I'm just planning to tell you a little bit about the different coalitions that I've been involved with, which are actually quite different in terms of their goals and their focus. And we'll be making some observations about what those differences are. So if you want to go to the next slide, Meredith. These are the different coalitions that I'm going to be talking about. The first, obviously, is a local coalition. The second, I should probably have put an asterisk there because this wasn't really, the National Committee for the Prevention of Elder Abuse didn't really identify itself as a coalition, but I think in many ways it operated as one. And I don't know if Bob is still on the call, but he may have some thoughts on that. So, because he was also involved. Then the last two are groups that I'm involved with now, the California Elder Justice Coalition, which obviously is a state level group, and then a coalition of state coalitions. So I'm going to go through each of these individually, and you can move to the next slide, Meredith. So the San Francisco Consortium really goes back to almost the origins of the field of elder abuse prevention. And I was just coming out of grad school and moving to San Francisco when a group had already gotten started And it was part of an organization called the the Coalition of Agencies Serving the Elderly, which had just gotten interested in elder abuse as the result of a congressional hearing. At that time, Congressman Claude Pepper and some of his colleagues had brought up this issue in Congress and started convening hearings around the country. One of those happened to be in San Francisco, which got some of our local service providers interested. And so they brought it to this meeting of CASE, and CASE assigned a task force to look into abuse. And so they really went on to what's kind of almost a textbook case of community organizing. This task force was able to get a little bit of money. They hired a consultant. They did a needs assessment. They surveyed agencies about whether or not they were seeing elder abuse, how they defined it, what they were doing about it, and what they thought should be done. And then drawing from that, they proposed a service delivery model for San Francisco. It was kind of an interesting process because at that point they decided that they didn't want to stay within the broader coalition, but to spin off as a separate group. And they decided that the best route to go would be as with a fiscal organization. And so they actually put out an RFP, and this was interesting because there was no money attached to it, but they asked groups around in the community who would like to take on this program, and agencies actually applied for it. So they went for this, they responded to this RFP, even though there was no money involved with it. And what that involved was the core program really revolved around the development of multidisciplinary teams, because in doing the survey, they realized that cases of abuse were surfacing at a lot of different agencies. Police were seeing cases, hospital emergency rooms were seeing cases, and the purpose really was to try to figure out how to help clients. And so a centerpiece of the program was a multidisciplinary team where people came together and talked about individual cases and came up with service plans that those presenting the cases could either adopt or not. It was really voluntary, but that was the basis. And then as they started developing service plans and learning more about the issue, they started doing professional training, developed a professional training component, and later went on to develop some direct services, including a small shelter program for abused elders and a support group for older victims. So it really became almost a laboratory for trying out new interventions and innovations as the field developed. And again, these were service providers from a lot of different disciplines, some of whom were working together for the first time, aging service providers with law enforcement, with members of the private bar, the judiciary. So it was similar to other aging coalitions, but with some challenges, I think, presented by the fact that we were really working across disciplines. So why don't you go to the next slide? And as I mentioned, the National Committee never really identified as a coalition, but I think it really operated as one. And what really got the National Committee started, I think, is that there was a lack of federal leadership as the field developed for really laying out any way of addressing the issue from a state perspective. And so Rosalie Wolf at the University of Massachusetts, who was interested in the issue, started pulling together people that were involved in elder abuse, either from a research perspective or service providers. And it was really kind of an effort to shape the field at the national level. So at those early meetings, we had researchers talking about the early studies of elder abuse and what they were seeing, and proposing conceptual models for how to address abuse. We also had people from the states who were trying to come up with legislation. And one by one, states were coming up with legislation, again, without any federal leadership. And so a part of the National Committee was to bring people together to hear from each other about what statutes they were implementing, what was working, whether or not they were advocating for mandatory or voluntary reporting, should self-neglect be included, all of those really basic issues. So was very much a conglomeration of researchers and practitioners and advocates. And a couple of their accomplishments were that because it was so research focused, they started working with a publisher to launch the Journal of Elder Abuse and Neglect. I think they really kind of set the stage for the Elder Justice Coalition, which Bob and others have been so terrific at moving things forward, and also to just kind of provide a voice for the field at the national level. The next one on the next slide is the group that I've been most active in recently, and that's the California Elder Justice Coalition. And we got started as a group of program managers, program directors, trainers, all of whom shared in common that we were grantees as part of the Archstone Foundation's Elder Abuse and Neglect Initiative. And I think at that point, Archstone was funding about 19 programs around the state. And they would bring us together a couple of times a year. And one of the things that we found, and this is true, I think whenever you bring people from elder abuse together, we started griping about some of the systemic issues that were creating barriers to what we were trying to do at the local level. And so we formed the coalition to try to organize, rather than just continuing to complain about these issues, to at a minimum analyzing them and writing them down, make lists. And then as we moved ahead, we decided to start meeting on a monthly basis by phone. We had a core group of about maybe 8 people, 10 people. And then we were able to get a little funding from the Archstone Foundation to convene the first summit on elder justice. And so we, from there, started recruiting people from around the country, or excuse me, from around the state. And that included individual agencies around the state, or we had some state level coalitions. And some of the kinds of issues that we were addressing were the fact that we had a lot of disparities between counties and how they were addressing elder abuse. There were also a lot of people that were going to the state legislature proposing legislation, some of which was good, some of which was really not so great. And so we wanted to try to organize a little bit to try to provide some expertise to the state in how they could evaluate some of these proposals that were coming to them. Some of our accomplishments, we done some advocacy, often in partnership with other coalitions, because we're very small. Although I should say we launched a membership organization in 2012, and now have about 90 member organizations. So we moved from that small group to a larger membership organization. But because we've remained small, we've worked with other larger organizations to try to kind of leverage what they're doing and helping to shape their agendas. So we've been able to, for example, successfully advocate for one person in the state office of social services to coordinate adult protective services around the state. We didn't even have that prior to that move. We've also been really involved in trying to get the folks that administer Victims of Crime Act funds to fund elder abuse prevention programs. We were seeing that most of their work was with younger populations, and so we were able to get them to sponsor what's now 25 multidisciplinary teams around the state. And we also started recognizing that to really have an impact, we also had to be looking at the national level, because a lot of what we were doing at the state level was really influenced by national legislation and national developments. So we started the National Advocates Academy, where we do webinars and some programming, bringing together advocates from around the country. And I'm sorry I didn't include our website, but our web address is elderjusticecal.org. If you're interested in joining or just learning more about us, I'd encourage you to join. I think another way that we've contributed to the field, and this is kind of from a more philosophical or conceptual perspective, is that around the time that we were getting organized was the time that that people like Meredith and Bob and through the Elder Justice Coalition had been able to enact the National Elder Justice Act, which was our first piece of federal legislation, which is basically about elder abuse, but it frames it as an elder justice issue. If you go to our next slide, you'll see that we kind of took the opportunity to use that new title of elder justice to go beyond elder abuse and to formulate some other principles of elder justice that bring in issues of discrimination and parity between groups. These were issues that we were dealing with that we felt were elder justice issues, but that were not really being addressed in the Elder Justice Act. And so we've been trying to kind of at least bring those issues and how we relate to them to the attention of other networks and working more closely with other advocates for human rights and social justice. So these are just some of the principles that we've come up with that we've been using. And one of the things that we've been working on lately that's been really interesting is that our state has launched an initiative to develop a state master plan in aging. And so we've been trying to bring into that discussion principles of elder justice. Can you go to the next slide? One of the things that we realized as we were moving ahead with the California Elder Justice Coalition is that there were other coalitions around the state. A couple of years ago, we organized a session at ASA where we had members of 5 different coalitions come together and present, and really to spend some time talking about what each of us was doing, but also reflecting on our differences. And that was a really rich and, I think, fruitful discussion. And we decided to keep the conversation going and eventually launched a national network of state elder justice coalitions that now has about 16 members. So we've been dealing with comparing state statutes, trying to have a voice at the national level, bringing to national policies kind of how we have to address these issues from a state perspective, which may be a little different from local communities and or other national organizations. So, for example, one of the issues that we've been struggling with is trying to develop services for adult protective services. One of the issues is that because of the way funding streams work, we sometimes are in competition with child prevention programs, which is not a particularly comfortable place to be, but it's kind of inevitable. One of the issues that we've faced at the national level, they've developed voluntary guidelines for adult protective services, and we're very concerned about keeping them voluntary because the local programs were very clear that they didn't want mandates that they weren't going to be able to fulfill without funding. But for those at the state level that are advocating for funding, we're competing with children's services, which are very regulated. And so it kind of puts us at a disadvantage. So there are situations where states have a bit of a different emphasis than local communities. If you go to the next slide, just looking back at these different organizations that I've worked with, this is kind of a laundry list of what some of the coalitions that I've been involved with, why they were formed or what their function has been. So again, from that early coalition of exploring problems, exploring solutions, becoming laboratories for testing innovations, providing an avenue to policymakers, and also trying to help policymakers understand our issues from the perspective of practitioners and service providers. We've tried to provide leadership to the field at the state and national level, generate support for policy reform, exchanging materials and best practices, and also promoting collaboration between researchers and academics and really any other stakeholders. And then my last slide is just, I sketched out a few of the different kinds of issues that I think have come up with the different coalitions that I've been involved with. one of the things that we often struggle with, and this is true of the other state coalitions that I've been working with lately, is they're struggling with whether, well, some of them are vary based on where the leadership came from. Some state coalitions were actually mandated or set up from the top down through AGs or governors. Others, like ours, were kind of grassroots, bottom-up approaches. And there are definitely advantages and disadvantages to both. When you have an attorney general start a coalition or sanction a coalition, or a governor, it definitely provides some clout. Oftentimes when they start coalitions, when policymakers start coalitions, you have an automatic entree. They may call for annual reports or hearings where you have a foot in the door to get back to policymakers. They can also have a downside, though. Obviously, political realities and exigencies. A new person is voted in and they're not interested in the issue, and so the support wanes. Another issue that people bring up a lot in coalitions is where sponsor administration. Do they want to go for to become private nonprofits, to have fiscal sponsors? And again, those have pros and cons. If you become a 501c3, obviously you have restrictions on the kind of advocacy you can do. Finding fiscal agents is often difficult. Again, you may have work with organizations that have, whose boards vary in the level of support that they want to offer the organization. And with funding, of course, you run into the same kinds of problems. A lot of groups operate on a voluntary basis for many years and don't really feel the need to incorporate or even to have a formalized structure. Some of them are self-funded, and that is obviously, that has some advantages. They certainly don't have restrictions on the kind of advocacy that they can do, as would a 501c3. But of course, then you're dealing with issues of sustainability and trying to come up with grants. And sometimes, just that moving from grants to grants can interfere with programs. You can't always find the right grant for exactly the kind of thing that you're doing. So again, coalitions vary a lot, and they really, how you decide to formulate a coalition or operate one really depends on where you got started and where you're trying to go. And I think that's, I'm going to turn it back to Meredith.
Great, thank you so much. That was very interesting. I'd like to introduce our final speaker, Bob Blancato, who is the National Coordinator of the Defeat Malnutrition Today Coalition, and he also coordinates the 3,000-member Elder Justice Coalition, which has been mentioned. So, Bob, take it away.
Thank you, Meredith. And now you have to listen because I have no slides. So thank you. First of all, it's great to be with Jeannie and Lisa because the two coalitions I'm speaking about, they have been very involved in, the Defeat Malnutrition Coalition and the Elder Justice Coalition, which, by the way, for both of them, they're the first of their kind, which is a unique place to be in a coalition. In the case of the Elder Justice Coalition, I'll start because it's the older one, it's 15 years old. It was established as a result of and in response to a piece of legislation in Washington. And it started with 5 founding members, one of which was the National Committee for the Prevention of Elder Abuse that Lisa talked about. And, when you go out, you start looking for similar-minded entities, aging organizations, people already involved in elder abuse prevention. That's how you start to build your coalition. And our growth was steady, but it also was accompanied by greater attention to the issue that we were focusing on, which is elder justice. And as we were growing, we became more engaged on Capitol Hill with the goal that any advocacy coalition seeks to be a resource to the Congress and to the administration. That leads you to be invited to testify at congressional hearings. And, we went through the process of working this legislation through. But at the same time, we discovered another important element of a coalition is to be an important resource to the media. Because the media, 10, 15 years ago was not very knowledgeable about the subject of elder abuse. There was a very celebrated case in New York involving a very famous New York family named the Astor family, and the grandmother was a victim of elder abuse, and a suit was filed by the grandson, but the media knew nothing about elder abuse. And so we were the resource they came to for what is elder abuse, what should we be concerned about, et cetera. And we also discovered that one thing that's very problematic in elder justice space is the lack of good data. And another important role for a coalition is to find ways to do either research or surveys that can produce some new finding. And we had that opportunity with a survey that was done through funding with MetLife that led to the conclusion that older victims of financial abuse were losing $2.9 billion a year. And that number just triggered all kinds of activity and interest on the part of people in Washington to deal with this issue. And the constants in the Elder Justice Coalition work was just our growth of influence in Washington. Our big moment obviously came with the passage of the Elder Justice Act in 2010. But now the space is very active again because the problem of elder abuse exists. There are more older people than there were 10 or 15 years ago. And there are new people in Congress who are very interested in this issue. And again, we started another new survey focused on the growing relationship between opioid abuse and elder abuse, which is giving us some other area to focus in. But as Jeannie noted, for a coalition to be successful, it has to focus on keeping its members informed and educated, putting out bulletins and newsletters, whatever you want to call it, doing webinars. We've done a number of them over our history, and meeting and working with congressional staff of those that are interested in the issue and giving them ideas for bills. So we've grown now to about 3,000 members from starting a group of 5. So let me run through what I think are the key elements of a good coalition based on the Elder Justice Coalition experience. First of all, know why you're forming your coalition. Be established for a legislative or policy issue that is in need of being addressed. Make sure that you are distinct and you're filling some white space that may exist in your area. Build your membership, and then as you build your membership, think in terms of having a leadership structure that can work with you on your key decisions that you must make as a coalition. Become a resource, but be a trusted resource so that you are called upon more than once by people for validity. Work on surveys, do research reports, maintain a constant advocacy presence, know how to raise money to sustain yourself, and then, of course, which does happen with coalitions, know when it's time to either keep going or fold up. Now, when it comes to the Defeat Malnutrition Today Coalition, which is now approaching its 4th year, one of the first rules we learned, and which I think also applies to coalitions, is have a good name. You know, we batted around all kinds of different things, and thanks to Meredith's great skills, we discovered that we could call ourselves the Defeat Malnutrition Today Coalition when you go on our website. And this coalition grew out of 2 things. Number one, the need to raise awareness about the issue of malnutrition in older adults. We focused on hunger in older adults, and we focused on food insecurity, but not so much in the area of malnutrition. And the second was to start moving some pending policy issues forward. And, you know, our initial and ongoing focus with the coalition is on older adult malnutrition. And this coalition, like many other coalitions, has been built from the ground up. Our founding members include Jeannie's group, the Academy of Nutrition and Dietetics, the Aspen Group, the National Association of Nutrition and Aging Service Programs. And now we are at 99 members with the 100th in sight, so to speak, with a wide variety of groups, including aging groups, health systems, groups like the Salvation Army and the Parks and Recreation Association, coming together to want to help raise awareness and contribute to policy movement. And so I think we have done our work in the areas of education and awareness. We've produced a blueprint on malnutrition, and a state toolkit for if you want to help get legislation passed at the state level. We do webinars, as we obviously are doing today. We conduct briefings on Capitol Hill, usually during Malnutrition Awareness Week in September. And on the policy side, we have been working with the Centers for Medicare and Medicaid Services for them to finally move off the dime and adopt 4 malnutrition quality measures. And we're making progress little by little, but we're doing so by working Capitol Hill at the same time. We had a bipartisan letter put together that Jeannie helped a lot to do with, that had over 35 members of Congress signing, asking the CMS to do just what we asked them to do. We see 2 new provisions in the Older Americans Act that the House has passed to allow malnutrition screening for the first time. And we have other initiatives that we expect to reach fruition come 2020. But the key is, it's all about maintaining activity. It's all about maintaining credibility, and it's all about being a resource. And with that, I'll stop and hope we have some questions.
Great, thank you. So if you have a question, please type it into the question panel. I will leave up the resources page, and in case you're curious, the slides and the webinar will be posted on the Defeat Malnutrition Today website as soon as it's done rendering. The recording takes a bit, but if you have questions for Jeannie or for Lisa or for Bob, please go ahead and send those in. Wow, no questions yet. I feel like apparently everyone was so informative that there aren't any questions. But I have a couple of questions of my own. So, Jeannie, you talked about you talked about why one might start a coalition. I'm sorry, I think I lost audio. So how would one determine whether there's already a group out there doing this work? Is that just a simple Google? Is that, do folks have, how would you go about making sure you're not redundant, I guess is my question.
Sure. Well, I think it depends on if you're talking about a local coalition versus a state coalition, but really, I feel like the best way to gather that information is, first of all, by just simply Googling and looking in your community to see if there's a coalition or group. But I think by talking with other people and having those conversations. So for example, if you brought together a group of nutrition organizations, you would be able to find multiple levels of coalitions out there that are, again, dealing with a variety of issues. But let's say that you came up with a list and it included a breastfeeding coalition or an infant maternal child health kind of coalition, or perhaps it was a coalition to look at preventing childhood obesity, or another nutrition, so increasing food security. All of those have this overlap and might have a touch point to malnutrition, but they might not be interested in taking it on as a primary topic. So I think even having an understanding in your own state of who's been advocating on what, that initial assessment and review process, because you certainly don't want to recreate the wheel. I bring up also the groups that have convened in some states like Massachusetts, where you had a group of people that came together and looked at this with a collective eye from the state perspective. But it could be that over time, if that group decides to disband, or if the work that they're charged with ends, not necessarily focused on Massachusetts there, but in that type of environment, what could happen is that a coalition could then say, well, there's an opportunity to carry out some of the projects or initiative that group identified as being important, but that they themselves did not take on. If you have a group within a state that's convened by the state, so you bring together a group of caregivers and perhaps they're looking at quality care in ambulatory settings, I just saw something along those lines. It could be that they have an initiative that might lend itself to a malnutrition coalition, but they themselves don't want to take that on. So those are the kinds of things I think that you have to really do that environmental scan and have some conversations within your group. Now, if you're just really bringing together a group of people, if what you want to do is advocate for a specific piece of legislation, or perhaps to work on some regulatory issues, again, that might not be the same heavy hitting approach that you would take with trying to form a coalition where you were going to meet on a regular basis and have a variety of initiatives. Hopefully that helps.
This is a great question that I think could be for any of our speakers. how does one bring a group into a coalition when you feel like they should be part of the coalition, but they're reluctant to join?
I think with
Go ahead, Lisa.
okay, I think with at the local level, I'm kind of scanning my head through all the different coalitions I work with. One kind of fairly consistent problem that the elder abuse networks have always dealt with is trying to engage law enforcement. And I don't know if that's, to some extent, I think it's a philosophical, not necessarily difference, but we look at things differently. And so I think that's something that has taken some extra finessing. One of the things that I think, and this wasn't really intentional, but it just kind of happened, is that, in the last couple of years, we've been able to bring more victim advocates into our network. And victim advocates, in some ways, kind of are a link the criminal justice from the social service network by explaining to us and to clients how the criminal justice system works and what victims' rights are. So that wasn't something that we originally went out to do, but I think now that we've recognized how important that is, have really tried to promote that. And that's actually occurred at the local, state, and national level.
I would also, to the point of, you want the group in, but they're not necessarily interested in coming on. You have to find out what the reason is. I mean, in some cases, it may be a lack of understanding about what it takes to be in a coalition or a member. A lot of times people say, how much it's going to cost me? And, you got to put that up front if there is a cost. Sometimes it's a question of, we can't go too deeply into direct policy positions, and that's fine as well. But the thing to do is to keep the dialogue going, to figure out if there's a common ground that would allow them to come in to the coalition, especially if you made the determination that they are they'd be an important entity to bring in. But it's worth the effort to find out what we've gone through this experience with a particular health system for a long time that's been trying to join the coalition for 4 or 5 months, but it's got layers of bureaucracy they have to go through before they can get final clearance. But we keep talking to them, and we keep thinking it's going to all come together. So I think that's certainly part of it. But Jeannie, any thoughts on this?
Yeah, so a couple things. I think the first thing is to think about what you really want or need. Is it the viewpoint of the organization, or is it the feedback and ideas from that type of individual or group that might belong to that organization? So let's say you can't get a particular medical group to come on board with your malnutrition coalition, but you can get a few physicians that are interested. So can you, by surrogate, get some of the ideas or concepts? So then another way that you might think about that is to, again, going back to what are the expectations. A lot of times people are reluctant to, in this day and age of coalitions, there are so many, and there's so many issues that are coming forward. Is it going to really be a valuable use of their time? So perhaps you invite them to attend, but you give them the opportunity to observe before they make that decision. The final thing that I would say, and this is something that we do a lot with policymakers, is that we invite them to come and speak. And one of the ways that you can increase awareness about a specific issue within an organization, we gave the example of the law enforcement, asking them to have a guest speaker come and speak at your coalition on a topic that is related to your issue and integration with law enforcement, or the interplay between the two, and ask them the question. So then you get that feedback, you make that connection, they get to see your organization, and there's some value in that. It might not work right away, but I think, we talk about relationship building all of the time. And I love the book, Your Network is Your Net Worth. This process of building relationships and getting people to the table wasn't built in a day. You are going to have some people that just by nature don't initially join. And just like Bob, my advice is to keep plugging away at that, and to, help them see the value, and to look for those commonalities and the common agenda that you share together.
And I would just second that. I think, the idea of bringing people in as speakers is terrific, because it not only educates your network about what they're doing, but it also demonstrates to them that, that their expertise and their perspective is really important to you. And, I think also just having them come in and, see who your members are and the kinds of issues that they have, will sometimes make it very clear why why their input is needed, or, the contrary, that maybe it's, maybe what you were trying to get from them is not something that, that's vital. Maybe the need was met just by the presentation.
So now we reached the 3 o'clock hour on the East Coast here. We want to say thank you to Jeannie, to Lisa, I guess to me too, and
yes, thank you.
but more importantly to Meredith for organizing this very important webinar brought to you by the Defeat Malnutrition Today Coalition. And of course, as she said in the beginning, for those of you who are in the malnutrition space and interested in pursuing this topic in any greater detail, you're more than welcome to join us in the coalition. We welcome your input, and we thank you. We thank you for your participation. Our email is on the screen. And again, we thank you for your participation, and hope everybody has a very good day.
Thank you.